So we've got things like the Health Information Privacy Code, which says in 1994, which tells us how we should manage your information, what we should do with it, how we should make it accessible to you. There's things like the Official Information Act, the Privacy Act, all those things guide making your healthcare information easily accessible. So the first thing that you need to do is, if you have any information that you want to know about yourself, ask at your local DHB, ask your cardiologist. You know, I want to have access to my, you know, my clinic letters, or, you know, some of my data. And they've got 20 working days in which to kind of give it to you. And it's best given to you in the forum that you decide you want to receive it. So you could get the information either, you know, verbally. People can talk you through what's kind of in all the documents. You can get printed copies of it. But I guess one of the big things I wanted to let you guys know is that the information is yours to access. And the other really, really important thing is that information is power and knowledge is power. And in order for you to make some good decisions about your lives and access things that you need, like, you know, insurance, health insurance, housing insurance, travel insurance, information to take overseas with you when you're going traveling, that's, you know, that's yours to have and access. There's a lot of information about how to access it via either you can go onto the Privacy Commission, and I've just printed down one of the things that talks about a quick tour of the privacy principles, which said that's how we protect your information. So really, you individually have access to your own information, okay? Now, if you're the mother of someone or a parent of someone with a congenital heart condition, then you have, you are the guardian of that person's information up until the time they're 16. Once they turn 16, the information becomes theirs themselves, okay? That's a real toughie for a lot of parents. That they can't, you know, that they're not, you know, they have to seek permission of their, you know, children to actually get at the information. But it's also really important because even at 16, there is legislation that protects information. If you had concerns about people, some people, so you can guide who you want to have access to your information. So there are ways you can protect who you want to see your information. So you could put you can write into your documents in any hospital who you want to see to have access. So if you don't want great aunt Doris to know any information about you or to see you in hospital or to have anything to do with you from a hospital setting, then you can actually put limits on who can access your information. In terms of, so that's really important. And in terms of finding out more things about your heart condition, there's information becoming more and more available on the internet. There's some fairly reputable sites that are out and around for people to access. Heart Kids have information on their own websites, but there's other international websites that are really important. There's a really good one called the American Heart Association. that has a fantastic website and talks about, it's the American version of Heart Kids. So it has a lot of webinars on there about living with heart conditions. And so that would be one that I would really recommend people just have a little look at. There are some other ones. There's some of the more reputable hospitals around in the UK also have quite good websites. Another one would be Bristol. If you go onto the Bristol website or the Birmingham Hospital website, that often has some good access, but I certainly would recommend the American Heart the American Heart Association as having a good access for information. It's actually the AACHD. So that's the website to look for if you want to have that kind of information. The do's and don'ts about, you know, living with congenital heart conditions. There's something that obviously we always talk about in our clinics, and I'm pretty sure nationally most people would talk about the same stuff. Our big push is to say, do anything. But knowledge is power, and making good decisions about your life is making sure that you've got all the information that you need when you're trying to make a decision about things. You know, examples of that are, we talk a lot about you know, lifestyle kind of do's and don'ts. We want to empower you to make whatever decision that you want to make, but that it's going to be in your best interests, okay? I don't know how, another way of describing that without kind of sounding like I'm there with a big stick kind of going, don't do that, don't do that, don't do that. Because we don't want to do that. We want you to get out there and live your lives. But what we want to know is to ensure that whatever decisions you're making fully resourced. Okay, does that make sense? Has anybody got any questions that they'd like to ask me to kind of, about anything really? We can't give specific information about any defects, but we can certainly kind of make broad kind of discussion points, if you like.
Actually, Christine, you said something about fully resourced. So where are the resources coming from? Can you just give more of a expand on that?
So are you talking about in the web page?
No, you said the do's and don'ts and lifestyle. You said about being fully informed and well resourced. So are you just...
Right. The best place for anybody to get any information about any lifestyle choice that they're choosing to make is to go to their cardiologist. Now, I know, like in Auckland, we're available nationally for you to contact us about anything that's happening. So we have a ACHD generic webmail that people can email us through with any questions that they have. We have a one telephone number for the 4 nurse specialists that are available in Auckland. But the other side of that is that if you're coming from a regional centre that has a cardiologist, an adult congenital cardiologist in that DHB, then we would always refer you back to your local cardiologist to seek some more information. So we will give out kind of generic information. We will even have direct communication with the cardiologists in your area, but we're a resource that you can go to seek some information. And particularly one of the good things for example, over the COVID-19 kind of window, you know, when we were all in lockdown, we had lots of people kind of confused about whether they should be going to work, whether they should be keeping themselves isolated. And we had lots of people kind of ringing in and seeking some advice over that period. And so we're more than happy to kind of be part of that resource, if you like. But there are other kind of places that you can find things out. We are such a digital age now, and even so some of the more international websites have really good resources on them. One of the things that we're doing, which will roll out in the next 3 to 4 months, hopefully, is we're doing an adult congenital website. So we're hoping to kind of start loading some local information on the do's and don'ts of life onto that, to have a, so that people have a New Zealand-based access that they can, or resource that they can get to. Dr. Tim Horning, he's had a sabbatical recently, and he's been going through that process. So I guess, you know, we're getting better at making and getting accessibility for New Zealand-based resources, but also we're expanding our service so that we can have a much more kind of national approach, if you like.
A question that we have, which is obviously a little bit broad as well, was someone wanted to know how much information they would need to give to employers about their heart issues.
Oh yeah, that's a real tough one, Claire.
Because obviously everyone's got different conditions, so it's not going to be the same.
Yeah, they do. Yep, and they do. But to be fair, actually, Claire, the issues are the same, and we have this quite often kind of popping up. Look, I think, and particularly in this time where there's a little bit of job insecurity kind of like lurking around, people are very anxious about disclosing their personal health concerns. One of the things I would say is just about every employer will either have some sort of health screening question in a questionnaire, and it is in your best interest to answer it honestly, okay? You are not required to give them any information. So, and when I say that, I mean, if somebody asks you a direct question and says, do you have any health issues that would be a concern to the company? Then I guess it is, that's always a tricky time. It would be in your best interests to be honest, okay, because that will protect you. But do you have to, you know, drill down to the absolute minutiae? No, that's not, particularly when it has nothing to do with the job that you're doing. So there is, so that's kind of like an answer of a question, but not an answer of a question, in the sense that I would not disclose any more information than I would need to, like saying, well, I've had some heart surgery when I was young. You know, I have to go and see the doctor, but there's nothing about that, you know, should impact on my work. Having said that, if your work is then lifting 100 kilos worth of concrete, and you've got a, you know, when we say don't lift weights, then you're not being honest about what you can and cannot do in that job. And so you lay yourself at risk. So I guess, you know, it's about being honest, but not necessarily, you know, putting your heart out there on the table at an interview. if you get a job, then sometimes it's worth going and having a one-on-one conversation with your employer, your immediate boss, and say, at times I may have to go and attend, hospital appointments, so that they've got a heads up.
Like an online portal where you can access your medical information, and I know that's quite, like, there's obviously security matters there, but just as curiosity, is there anything, possibly out there in the pipeline around online portals to access information? Or
Paige, I'd love to be able to say that there was, but given in COVID-19, actually none of the DHBs talk to each other. I don't think that that's kind of going to be immediately in the pipeline.
Yeah, no, I understand. Yeah.
Can I just say that Canterbury was working on it when I left Canterbury DHB 2 years ago, and at that time they were actually working on it. So I don't know where they're at, and the rollout would have been eventually going nationwide. But just like Christine said, don't know where it's got to now.
Yeah,
sounds amazing though.
But that's what they're looking towards. So that way, when I spoke to the charge nurse for the paediac, that's where they're at. So that way, eventually, children, once they become adults, can have access to their data, which is going to be online. So it is coming, but we just don't know when it's going to happen.
Some of the Pegasus practices do actually have all your results online. You can book appointments and stuff like that as well. So there is a lot of information you can find from your GP practice.
Christine, for 21 years I've had wonderful cardiologists, and I can't say highly enough about them. But for 55 of those years, I never ever received any patient feedback or reports. They were always sent to my GP, but that was just one point. But I'm glad that's changed now. And the secondly, if a cardiologist retires, do you let that person know? Are they given a choice in their next cardiologist? Because I think that's really important, to be able to at least two choices.
Linda, you're quite right. What we do now, and I guess that's response to the changing environment in terms of, the Privacy Act, and in terms of the Health Information Act and all those sorts of things, is you find that everybody, and so this is a little plug also from the outside a little bit, is that we always send letters. We CC the individual who we've seen in clinic, or any discharge information. It goes to the person who it's most important about, which is the individual, and we also send it to the GP to ensure that they know what's kind of going on with the individual.
Very important.
Which is very important. Our ability to ensure that you all get your information is dependent on the current information that you give the hospital about your place of residence. So if we have your home address, which, to be fair with the younger guys, could be your parents, because we know that you're shooting all over the show. But we will send out our information to your last known residential address. If you're not there anymore, we can't kind of protect its security, and we can't ensure that you've got it either. But the good thing to know is that always your GP will get a copy as well. So if
I always got the appointment times, but I never got the reports ever.
Yeah, and since basically, to be fair, probably since '94, it should always be going to the individual as well as the GP.
Can you ask for an email copy?
Now, that email copies are a little bit tricky, because The DHBs are also, and I'm speaking very globally here because, or very nationally, I should say, because I know what our policy is in Auckland, and I can't be absolutely sure what the policy is around the country. But I know Auckland DHB, there's a whole policy around email security. And one of the big problems is email security cannot be guaranteed for Yahoo and Gmail. So they're not fond of sending email information out to unsecured emails, which is Yahoo and Gmail. However, if you alert your DHB to the fact that you would like to have email information, they will generally send it out by email. But there possibly may be kind of like a disclaimer that says, we can't be sure of the security of this email. Okay, does that make sense? Yeah. So from an Auckland perspective, if you're in the Auckland clinics and you tell us that you want it by email, we can generally facilitate that. I would say it will be the same around the country. If you tell your local DHB or your local, when you're in visiting the cardiologist, that you'd like to have it by email, they'll try and make it so.
Christy, my other question was about when a cardiologist retires, do you let that person know, and do we get choices? I'm in the lucky position of not having any of our cardiologists in Auckland retire. So, but what generally happens is that, unfortunately, because adult congenital cardiology is such a specialist kind of environment, there's in a way, there's almost like a limited flow of people being trained into or choosing to do adult congenital cardiology as their focus. So yes, we would like to say that most people, when they're choosing to retire from a cardiology perspective, usually have a couple of years of kind of, I'm going to leave here. And so they will try and notify everybody that they're moving on, but that is not always able to happen because it depends when your appointments are, if it happens to coincide with the retirement possibilities of the cardiologist. Do you have a choice about what cardiologist you go to? Certainly you would have a choice from the perspective that it would be an adult congenital cardiologist and there would be some sort of handover kind of process. If you were unhappy with your cardiologist that you were allocated to, then feel free to speak up and ask to see someone else. And we certainly have many of our patients say, actually, I would prefer to see this cardiologist, or, you know, it's a little more difficult in some of the regional centres. It would be fair to say, yeah.
Just going back to the clinic notes and stuff, who actually reads them and keeps them and has a record of them?
So the clinic notes are all, again, I'm speaking from an Auckland perspective, but I'm pretty sure that it would be fairly standard around the DHBs. As I showed you, we have a whole policy about how notes are managed. So we're very much dictated by policy and by government about how to secure your information. So the information, we will write notes at the clinic. They stay in the hospital. They are then scanned onto a digital record and then either stored or, are stored, yeah.
So just sort of asking the other people who are here today, like now that you're adults and taking responsibility, do you actually have a file at home with all your clinic records in them?
Yes. I always keep them.
Yeah.
Just in case.
I got a whole load from my doctor
just a few weeks ago because they were shifting. So they found a whole load of my old notes in their attic. So they sent them. So yeah, I sat down and went through all my notes. So I don't have mine.
Hannah, you just recently had to change your, over to another country and get your notes. And I know you're doing a process. How, I haven't spoken to you since then. How has that process gone? Have you got your stuff? How complicated was it?
I haven't actually got further than printing off the forms from my GP. So I got a little busy.
It's in your court.
So it's in my court, but what the form is I fill it in, I send it back to the GP, and then someone's able to pick that up in person. So I probably should have done this before I moved. But they're happy to email it if need be. They just need proof of who you are. Most pretty easy.
Yeah, most DHBs, most GPs will have some sort of formal process, because again, it's dictated to us by legislation that says we have to have a way in which people can access their notes if they want to. Yeah. So like in Auckland, we've got the CR 625 form that has to be filled in if you want to have access to your notes. And bearing in mind, for a lot of people that are, have had their surgery in Auckland, who now live regionally, sometimes that's the only way they can get a hold of their op notes if they haven't. Although, to be fair, most of the regional areas get the op notes as well sent down to them. Yeah.
So if you change your, say like I'm in Christchurch, if you change your address, when you're talking about addresses, in Canterbury DHB, does that change it for every DHB or not?
No, not at this stage. We would only go by what the last address was that we that we had when you were in Auckland. So yes, we have lots of people who are, around the place, and we've still got very old addresses. But interestingly enough, it's one of the things that's kind of popped up in the contact tracing for COVID-19 is that there's no formal way of kind of tracking New Zealanders from a health perspective. And the other incredibly interesting thing is that we have a highly efficient system that's actually way better than Australia, America, or even the UK. If you change NHS trusts in the UK, you basically physically have to walk to the new doctor with your file. Yeah, there's no kind of standardized national health identifier in any other country. We're very lucky in New Zealand. Yeah.
Another question that someone had asked is how do hold on, I'm just going to go read this so that I've got the wording right. How do people access more support once they're adults around issues with their heart defects? Okay.
I guess I'd have to kind of understand what they're thinking about as support. Certainly, like from an Auckland perspective, which is terrible, makes us sound awfully Auckland centric. It's not. Certainly, if they have concerns and they don't feel that there's anybody in their local area that they could contact, we would strongly encourage them to ring us or email us in the Auckland office, because we are a national service. We're attached to the Paediatric and Congenital Cardiac Service. So in the same way that you have the nurse specialists for when you're in paediatrics, we've mimicked the kind of environment in the adult service. So we have, so I would strongly advise people to ring us, and then we can kind of see if we can help with any support that people may need. However, having said that, the local, your local areas, speaking to your cardiologist. I know that Christchurch has done some work with Suzanne to try and kind of meet the needs of the adult services in Christchurch by kind of designating some time for her. I know that Wellington are starting to look at those kind of roles as well to to see how best that they can support the kind of growing population of adult congenital people that are there. Some of the other regional centres may not be so well supported, but generally what you tend to find is the heart failure nurse specialists from the general cardiology population often pick up some of the of that kind of role. And if anybody is concerned, they can contact us and we can try and link them back into people in their local DHBs. I feel like at this time I should put up my card and say, ring us.
Yeah, that's a good plan.
Yeah.
Does anyone else have questions for Christine? No.
What I would strongly say is that if people want any of their information, ask for it. It is absolutely okay. It's 100% okay. Your information is your information and it is yours to be accessible to, and information is power, and so that's a really, important part of kind of your responsibilities too, in terms of kind of understanding better how to kind of move forward with things.
Yeah, can I just add on to that? From a Canterbury point of view, if anyone wants their clinical notes from their DHB, I don't know the number of the form like you did, Christine. That was pretty impressive.
I've got it right in front of me.
Okay, well, I haven't got that. But our clinical records, they actually have a form. So if you wanted a copy of your clinical records, you just have to ring up and they'll send it out to you, or they can email it out to you. You fill in the form, send it in, and it usually takes anywhere between 6 to 8 weeks to get a copy of your clinical records sent out to you, and that's everything in its entirety. And that'll be the same. Or if you wanted to go in to review your clinical notes, they will actually get a privacy officer to sit with you to go through your notes if you wanted to. And you may want to advocate at that time as well.
And so getting your notes as an adult, is that your notes right back to say, like, when you were born?
I'd say
if you've been in the hospital system since then? Yeah.
If you were born in the DHB here, it's all your notes that you can get a copy of. And some people have got volumes and volumes of it. So there is a lot. For some people, it's a lot.
And so the other one was, like, say you've got Karen who lives in Christchurch, she'd have to go through the CDHB and then the ADHB as well, or
separately. Yeah. Because they're separate DHBs.
She could email. She can whatever. So if you've got people in split DHBs, you can apply to Canterbury DHB for your information, and then you could apply to Auckland DHB for your information.
And so Auckland DHB includes Starship? Or like Green Lane? Well, a lot of these guys would have gone Green Lane.
The good thing about it is, because I used to work in Green Lane, and quite often when we see people in clinic, because obviously if I see someone in clinic, I look and review their notes, and so that information is there, and it's theirs to own.
So when you request the notes, do you request like a complete set, or do you just get clinical notes, nursing notes, and do you have to actually specify which type of notes?
No, all I've ever done was just requested clinical notes, and they just photocopy the whole lot. That's the old way. They may they might scan them nowadays, but historically it was they just got all your notes, they photocopied it, sent it out to you through the post. So that's
so if I'm, and I would honestly, because most of the stuff actually is covered in the information of release of information under the Act. What we basically the information has to be delivered to you in the way that you want it delivered. If you want photocopies of it, it will be delivered. If you want to come in and read it, you would have somebody appointed with you where you can do it. If you wanted somebody to verbally talk you through the notes, that they will do that. We absolutely recognise the patient's right to access the information. The request for patient access to the information contained within a clinical record must be made either with the use of the release of information request form, which would be the same at whatever DHB you're at, just a different kind of number, or you can actually just send them a letter saying, I would like to see my files, and this is how I would like to see them. They, by law, they have to respond to your request within 20 working days. Now, that doesn't mean that they have to give you the information in 20 working days, but they have to tell you how they're going to give you the information within 20 working days. Yeah.
Is there any other questions? No?
I just wonder, how long would it, or does it like take to change cardiologists through different DHBs? Because I've been having lots of like lightheaded spells and that lately, so they want a cardiologist to see me, but I've only just moved up to Tauranga. So
where did you come from, Chelsea? From
Canterbury.
Canterbury. Usually, if you've seen your cardiologist quite recently, then it would be in your normal cycle of review, most likely. If you move your DHB and you are finding yourself unwell and don't even know who your and you don't know who your cardiologist is going to be, and you haven't met him or anything like that, or her, or anything like that, then your best port of call is always to go to your GP. So no matter where you go, this is a finger shaker. No matter where you go, guys, you always got to have a good GP.
Yeah.
So you go to your GP and they will refer you into the process. Yeah.
Okay.
And generally what we would say to people is, if usually within a year of going to a new environment, if they haven't had any contact with the cardiologist in their particular area, then get the GP to put a referral through so that you're going to get put into the system. Yeah.
Yeah, they put a referral through a couple of weeks ago, but there's been some confusion from what's my records are saying. I haven't seen a cardiologist since 2015, but I'm pretty sure I've seen my cardiologist since then. So, yeah, I'm just hoping that it's sooner rather than later that they get the referral through.
Yep, and don't forget, yet again, there's another little kind of moment. If you are having, adult congenital peeps are fabulous because they'll struggle onward through feeling not well and all the rest of it. And don't forget, if you feel bad, go to either your GP or to hospital.
Yep.
So in terms of COVID, is there any, personally it's probably a personal thing, haven't got because usually I get MRI or a echo or a ECG before I go see my cardiologist, but I haven't had any appointments or anything made, but I've followed up multiple times. But just in terms of COVID in general, has that had an effect, I suppose, on appointments and that sort of stuff?
So you'd find that probably most of the centre, like we all, stopped, took a big breath, waited for the the kind of influx to come into the hospital, which fingers crossed didn't happen. But what it did do was we tried to ensure that everybody who needed to be seen got seen. We did a lot of virtual appointments, and I'm pretty sure that this is what will have happened around the country as well. There was a lot of telephone calling, are you okay? And then looking to see you in the next 3 to 6 months kind of thing. So it has probably made what would be your routine appointments a little bit slower. Again, if you've got any changes in your condition, then ensure that you see your GP and maybe get referred forward, or if again you're really unwell, then take yourself into the ED and get yourself seen.
Okay, thank you.
So I might jump in. So Hannah Wakelin down the, well, she's on my bottom, she's potentially not on your bottom, is a heart adult who is currently living in England somewhere and is working at a genetic counsellor. So she was just going to introduce herself and have a little bit of a, if anyone had any questions for her about maybe moving overseas or her line of work. I'll put it over to you anyway, Hannah.
Wonderful. So hi guys. So yeah, I'm Hannah. I'm currently in Oxford working as a genetic counsellor. And so as a genetic counsellor, what I do is I talk to families if they think that there might be something running in their family that could give them a disease or increase their risk of cancer, that sort of thing. And sometimes I talk to pregnant women when something weird has come up on a scan and they want to have a bit more of a discussion about that. Unfortunately, here in Oxford, the cardiac genetics team is a different team, so I'm not seeing any cardiac conditions at all. But even then, it would be really hard to give any precise answers in this sort of forum. We all have over 25,000 genes, and for most conditions, we just still don't know if or what a genetic cause might be. But if you've got any general questions, I'm happy to try and answer them, or about moving overseas. So COVID sort of made my journey a little different.
How did you go insurance-wise moving overseas, like health insurance, you know, like, I suppose you didn't really need the travel insurance, but do you know what I mean? Like if anything happens over there, can you use their health system? And
yeah, so I was born over here and it's where I had my first operation. So I'm in on the NHS, I get all that. So I'm seeing a cardiologist in September for echo and pacing and everything. So I've just managed to fold in by seeking a referral from my GP. But I do know that quite a few New Zealanders can join the NHS and use that. But I'm not entirely sure on the process, sorry. But you would at least get emergency care if you came over and something happened to your heart.
Yeah, I was just thinking, Hannah, is there reciprocal care between, actually, Judith might know this question as well, but isn't there a reciprocal care between England as well as New Zealand?
I'm really sorry, I didn't have to worry about it because I was born here, so it wasn't really something I looked into.
There is. I've just come back to New Zealand after 6 years away, so I lived in London for 3.5 years, and when I first moved over, Annette was the nurse specialist at Auckland at the time. She just sent a referral over to the UK for me, and it was very easy. I was seeing the heart and lung specialist in London for my period of time in London, and it was like the clinics just ran like clockwork. Every time I had a schedule that would come in, and it always went to schedule. I was never waiting around. It was really, I had great positive, like a lot of positive feedback with my experience in that. But yeah, it was reciprocal.
But travel insurance, oh yeah, I just told them what I had and paid the extra premium to cover that.
oh, does anyone else have any other questions? No. So I think we were going to go to a breakout room, but because it's low numbers, I think we decided that we won't. Is that right, Matilda? Yep. So the other one that we had was Grace has just come into us now. She's been playing netball, and she has, and I'm not sure if people have heard, but it was spoken about in here on one of the other meetings about a young advisory board, I think it's called, that Heart Kids have created, and applications came through over the last month or two, and Grace has made the board for Canterbury or the South Island, one or the other. So she was just going to have a chat about whatever she'd like to chat about, and let you guys hear about it.
Okay, yeah, cool. So, hey guys, I'm Grace. I'm in Canterbury, and I'm just here to chat to you about what I know about